we just wanted to take a few minutes this morning to highlight some of the great work being done throughout the system and our social impact priority initiatives. You know, as we look back over last year and to the beginning of the practice, we are reminded that this work is driven by a common goal of responsibility and commitment to take care of our communities, our patients, and our fellow employees. And we also know that this work is local, and having our CEOs and social impact leads here today calls for a shout out to their tireless effort in this space. It is their laser focus on this North Star of others first that has allowed us to continue to move the work forward. Next slide. So our work in the food security and education pillar started a few years ago at the Beth. We discovered early on that to make a real impact in one's health in this space, you need to not only provide access to healthy food, but the education that helps promote healthy choices and how those choices can determine your health status. I think this proverb speaks volumes to our strategy. Next slide. So as I said, our work has grown significantly over the years, and the need really only heightened during and following the pandemic. COVID presented so many challenges for us, but we were able to find unique opportunities and new strategic partners here. I think the Common Market and our Farm Box delivery program is one great example. Since 2020, we have participated with them, where our social impact leaders in all of the facilities, including Trinitas, help to distribute fresh produce, yogurt, eggs, and bread to their local agencies in need. And since we began this partnership, we delivered close to 30,000 farm food boxes. Now, this translates to 120,000 healthy meals to soup kitchens, pantries, and even door-to-door to families. So, this really helped us to feed those who are food insecure, and as well as supporting our local farming industry. Next slide. So another important highlight in partnership in our work is with the Community Food Bank of New Jersey. They have been wonderful partners in this space, and together we are serving our most vulnerable populations, such as our pregnant women and their families, and those with chronic conditions. We provide healthy food and nutrition education in our Women's Wellness Pantry at Newark Beth, our Live Well Center and Green Market in Eatontown, and our food pharmacy in Jersey City. And I'm very happy to announce that we've expanded the Women's Pantry model this year, adding New Brunswick as a partner agency. And with pending appropriation dollars, we're looking to expand to other RWJBH communities, including Toms River, Mercer County, and Lakewood. The goal here is to set up food access and education access sites in these key locations, together with our facilities. And this is a result of the work and the relationships that are already fostered there. Next slide. And our ability to reach community members through SNAP, WIC, and Senior Farmers Market nutrition vouchers continues at our Beth Greenhouse and Farmers Market, and is expanding as well. This year, we were actually able to distribute these senior vouchers as well as redeem them, which further expanded our reach. And it's our hope that more of our hospitals and their community partners in this space become points of distribution for these important services. And addressing the needs of our employees, we have celebrated our second year in partnership with Sodexo and the Common Market together, setting up Farmers Market and Sodexo managed sites. These markets provide healthy farm food together with wellness education through our on-site Be Healthy coaching team. I also at this point wanted to give a shout out to Community Medical Center and their Community Closet Initiative. This is a great program which provides food and other needed items through employee donations to fellow employees as well as the community. And to ensure that all of our employees have access to this healthy food, we're in the process of developing an online mobile farmers market, thanks to the funding from the employee campaign and the efforts of Vicki and Glenn and their teams. In this program, we hope to deliver fresh farm food through a subscription platform at 30% off for our employees, as well as offering them the ability to redeem SNAP vouchers if it's eligible. So more to come on this in 2023. Next slide. Our Kids Fit nutrition program continues to evolve and expand. I'm so thrilled to say that it is currently being implemented in all of Newark's 41 public elementary schools and 10 of its charter schools, as well as 5 schools in Jersey City. And we've also continued our presence in East Orange and Carteret school districts. And so with that, we can say that we have a grand total of 75 schools who are using our curriculum for their 3rd to 5th graders as a part of their health and phys ed education plans, lesson plans, and learning objectives. The infographic here shows the improvement in healthy food choices and nutrition knowledge after kids receive this education. And I just want to give a shout out to Elliot Liebling and the IFPR family for helping us illustrate these outcomes. So looking ahead in 2023, we hope to begin to connect our Kids Fit Kids and their families with fresh farm food and SNAP Ed through our partnership with local farmers and the Community Food Bank. We're also hoping to roll out our pre-K curriculum in the Head Start program in Newark in 2023. And finally, we're also very excited about our pending legislation that would actually put Kids Fit in all New Jersey elementary schools. A big thank you and shout out to our policy and government affairs folks for supporting this. And certainly last but not least, our Wellness on Wheels program is on the road again in full swing, has educated over 12,000 community members, including seniors, elementary school students, and employees this year. And all of these programs, keep in mind, are helping to make that important connection between healthcare, education, and agriculture, which will move the needle even further in the food security space. And with that, I'm going to hand it over to Elizabeth, who's going to provide a few more highlights in our education and volunteerism spaces.
Thank you, Barbara. Thank you, Diana, for advancing the slides. So we are really excited this year that we were able to bring back our cost of poverty experience, the in-person version. For those of you who participate in our virtual, you know that we were at the forefront, both creating the healthcare model for the in-person and the virtual experience. And in Q4, Monmouth Medical Center and the Southern Region hospitals collaborated and held 2 back-to-back cost of poverty experiences for our system. We host this cost of poverty experience because it gives our employees and community members an opportunity to get a glimpse of what it's like for some of the folks who may be our neighbors, our employees, certainly many of our patients who are struggling with generational or situational poverty. To Mark's comment earlier in the meeting that, you know, the tensions that we're feeling with the current economic forecasting and the rising cost of living, it was estimated that a family of 4 in New Jersey needs about $75,000 a year just to survive. Nearly 40% of the individuals within our catchment area do not earn that much. So by offering this cost of poverty experience, it demonstrates folks who may not have that lived experience the challenges and the decisions that folks need to face on a day-to-day basis, and sometimes the trade-offs they need to make, whether it be healthcare, healthy food, and other decisions. This training is based on real life experiences of families affected by generational and situational poverty, as I mentioned. And by having this understanding, RWJBarnabas Health employees are better positioned to thoughtfully interact with our patients and communities, which will better position our system to provide equitable care and meet our mission of creating healthier communities. What I really love most about this program is that we've been able to go beyond the scope of our own employees and invite community partners and other key stakeholders to these experiences. Through the Southern Region, they had folks from local government, such as mayors, folks from the Housing Authority, the VNA, executive director from local FQHCs, RWJBH clinicians, employees, executive directors from community-based organization and other nonprofits, staff from local community colleges and other school districts, whether elementary or high school, and as well as Ocean County Health Department members. So we know that strategic partnerships are really foundational to our work in this space, and we can't do it alone. So being able to open those doors has been really exciting for us to include them in that cost of poverty experience. More so, having folks that maybe aren't so familiar and living in this work day to day is really exciting, that we were able to host and sponsor a cost of poverty experience at the New Jersey League of Municipalities through our strategic partnership with the New Jersey YMCA Alliance. Next slide, please, Diana. And building on those alliances and those strategic partnerships that we have, all of our site leads who are at our acute care facilities are deeply ingrained in their communities and are, like we said, the boots on the ground and really manage and foster those relationships. So they could give you a plethora of information of what they're doing in the community. But since we're doing just a quick highlight, this is some of the partnerships that we have at the corporate level for our social impact work. The first one all the way to the left is with our United Way of Northern New Jersey. They have created United for Alice. And in the past, we've spoken, Diana has shared and educated all of us on Alice, the asset limited, income constrained employed population. And their goal is to shed light on the everyday struggles of the household that are Alice. And with our support, United Way was able to publish 3 research series spotlighting the struggles of people in specific Alice populations, doing a deeper dive in folks who have disabilities, children living in the Alice segment, and then as well as military veterans. This gives us a plethora of data that we're able to dive deeper in and splice and dice, to use the EPIC term, over demographic and different measurements and different categories, and then which allows us to make better decisions because we know the challenges that they're facing, and data-driven, evidence-based decisions for these groups. The Summer Youth Employment Program is a program that we've supported as an organization for the last few years. It is based in the city of Newark, and we partner with our wonderful team over at Newark Beth Israel Medical Center to work and support this program. It's a 6-week summer experience that offers youth ages 14 to 24 the opportunity to gain exposure to the world of work and develop important skills focused on work readiness, leadership development, and financial literacy. Their mission is to contribute to the development of Newark's next generation of leaders by helping them understand what is possible and envision a future of personal and professional success. They recently reached out with their year-end report and all of the success with their measured outcomes. If you'd like to see that, we'd be more than happy to share that with you. But this has been a really great partnership that we have had in our youth workforce development arena. And also to the right, which is very timely, coming up to the Dr. Martin Luther King Jr. Day in January. Back in early 2022, we partnered with the New Jersey Institute for Social Justice during our MLK Week of Service. Their president and CEO, Ryan Haygood, was a member of our inaugural External Advisory Council team that helped shape our social impact practice and really helped guide us and figure out where we are going. And what we were able to do in our MLK Week of Service last year was partner with him to host a virtual conversation with him and some members from his team, and also featured a video with interview with attorney Fred Gray, who was the iconic civil rights lawyer who represented Dr. King, Rosa Parks, Claudette Colvin, and the victims of the Tuskegee medical experiments. And they have been a great partner in this space as well. Next slide, Diana, please. And through our partnerships, we've been able to deepen, again, our roots in the community, and then also tie it into our volunteerism and employee engagement platform. As you know, our MLK Week of Service, which we now have kind of dubbed the season of service because it's gone beyond the week, really is the kickoff to our year of volunteerism. We know volunteerism was a great way to engage our employees, as well as be part of our Be Healthy program, because of the evidence that it can impact our own health and wellness by giving back to others and providing service. So that will be coming up. So please stay tuned for that. And I really wanted to just kind of take the moment to close out our presentation and recap of the year to give a shout out to the Trinitas team. They really hit the ground running with the social impact work. Being new to this work and to the organization, volunteerism was somewhere they could kind of dive in and dive deep. They've had longstanding commitment to their community, and it really shows. They participated in our Common Market partnership and have been active in our volunteerism space. And we have been running this MLK Week of Service for more than 5 years, and are going to be once again partnering with our diversity and inclusion folks and the folks in ERT to provide programming throughout the week. So please stay tuned for more information, and please do not hesitate to reach out to our team with any questions or looking for any more information.